Today I would like to share some basic information with you about gastrostomy tubes. A gastrostomy tube, or G-tube, is a silicone tube placed into the stomach or intestine through a hole made by the doctor. It is placed by a doctor to give formula to a child who cannot take enough food by mouth. It can also be used to give medicine and to vent or burp the stomach. By feeding your child through a G-tube, he can receive enough calories for his body to grow at a normal rate. There are many types of G-tubes. Some doctors place long tubes, such as this. Most children in our hospital have buttons. A button is a small tube with a removable extension tube that connects through the center port. This allows the child to be active between feedings without fear of pulling on the tube. G-tubes have an internal bolster and an external bolster. Bolster is another way of saying support. These help secure the tube in place. There are two types of internal bolsters. PEG tubes have a firm bolster that must be inserted and removed by your child's doctor. Other tubes have a balloon bolster. These can be replaced by the child's family. This video will teach you how to care for the G-tube and the skin around it, how to feed through a G-tube, how to give medicine through a G-tube, how to burp or vent a G-tube, what to do if the tube comes out, and common problems. It is important that you keep the skin around your child's gastrostomy site clean and dry. Each time you clean and dress the site, inspect it closely for signs of skin breakdown. Before you begin, collect your supplies. You will need soap and water, cotton swabs, a new dressing if you use a dressing. Remove the dressing from around the tube. Moisten the cotton swabs in soapy water. Begin at the tube or button. Wipe around the tube with a wet cotton swab, working away from the tube or button. You may need to use several wet swabs to get the skin clean. Rinse the skin with cotton swabs moistened with plain water. And then dry the skin with a dry swab. Usually, you do not need to use a dressing around the tube. However, if you prefer to use a dressing, place a dry dressing around the tube after you clean it. Always secure the tube or extension to the child's tummy with tape to help prevent irritation or granulation. Always keep the G-tube site clean and dry. There are two ways to feed your child through a gastrostomy tube. Continuous feeding, which is when you give the feeding all the time or over several hours, and bolus feeding, which is when you give feedings over short periods of time. There are a few important points to remember when feeding through a G-tube or when giving medication through a G-tube. Buttons are placed to allow more freedom for the patient. This extension should be used for feedings and for administering medications. The extension can be removed between feedings to decrease the chance of having the button pulled out. To attach the extension, open the flap on the button. Line up the markings on the extension and the button. Insert the extension into the button and turn the extension clockwise. To remove the extension from the button, turn the extension counterclockwise until the markings line up, then pull the extension out. Close the flap over the button. Whenever the extension is connected to the button, it should be secured to your child's tummy with tape. This will help prevent granulation tissue and help to keep the tube from being pulled out. Prime the tubing and extension before attaching them to prevent air from entering your child's stomach. Also, make sure to clamp the tubing and extensions when they are not being used. If your child is being fed continuously, flush the tubing with 3 to 5 milliliters of water every 4 to 6 hours to keep it from clogging. It is very important to flush the tube before and after each feeding or medication to keep the tube from becoming plugged. When the feeding is complete, be sure to flush the G-tube with water. Rinse the extension in warm water and allow it to air dry. In this video, you will see the process of giving continuous feeding with an electric pump. There are many types of feeding pumps, and usually your child's home health company will decide which type you will use. For now, we will learn the basics. Make sure that tubings are primed with formula or water to prevent air from entering your child's stomach. Remember to clamp the tube when disconnecting the feed. In this video, you will see how to give a bolus feeding. Bolus feedings are given over a period of 20 to 30 minutes. To give a bolus feeding, you will need formula, water, and a 60 milliliter catheter tip syringe. You can change how fast the formula flows by raising or lowering the syringe. Giving the feeding too fast may cause your child to have pain, discomfort, or diarrhea. Remember to flush the G-tube with water after the feeding. Some medicines can be given through a G-tube and some cannot. Always check with your doctor or pharmacist. Most liquid medicine can be given through the tube, but some are too thick. For example, liquid Tylenol must be mixed with water, and afterwards the tube must be flushed thoroughly to prevent clogging. If a pill can be crushed into a fine powder, it may be given through the tube. However, time-release medications and enteric-coated medications should never be crushed and given through the tube. Some medicines clump when they come in contact with food or other medicines. Clumping will clog the tube. Because of this, never mix medicines together and never mix medicines with food in the tube or the feeding bag. These should be given separately and the tube flushed in between. Never put anything into a G-tube button except the extension. If you put a syringe or anything else other than the extension into the button, it can damage the one-way valve and allow stomach contents to leak out. To give medications through a G-tube, collect your supplies: a syringe, water, dose of medicine. Remember to flush the G-tube after giving the medication. Just like nursing babies or bottle-fed babies, children fed by a G-tube can get air in their stomach. If your child acts uncomfortable, you may need to allow the air to pass out of the G-tube. This is called venting or burping. If your child has had a Nissen procedure, they are unable to burp on their own, so they will need to be vented. Your child may need to be vented at these times: 1/2 to 1 hour after feeding, if your child seems uncomfortable during a continuous feeding, if he is fussy, if he is gagging or retching. If you do not hear air come out and your child is still uncomfortable, remove the syringe from the tube and replace the plunger. Then attach the syringe to the tube and pull back gently on the plunger. If the stomach contents enter the syringe, allow them to return to the stomach and flush with water. Remember to rinse the extension tube with warm water and allow it to air dry. After your child's G-tube is placed, you will receive a G-tube emergency replacement kit. It's very important that you keep this kit with your child at all times. We'll use this if the tube is accidentally pulled out. The stoma, or hole where the G-tube goes in, can close very quickly, sometimes in just 20 minutes. This can happen even if your child has had a G-tube for a year or more. If your child's tube comes out, stay calm, wash the tube with soap and water, check the balloon for leaks by filling it with water. If the balloon holds the water, you can put the same tube back in. Remove any water from the balloon first. If there is a leak in the balloon, throw the tube away and use a replacement tube from the G-tube emergency kit. Replace with the same kind of tube that came out. Gather your supplies. Lubricate the tube and put it into the stoma or opening. If your child has had the tube for less than 6 weeks, tape it in place and call the physician. If your child's tube has been in place for more than 6 weeks, inflate the balloon, then check for placement. To check for placement, attach the extension and withdraw the stomach contents with the syringe. If stomach contents can be withdrawn, return them into the stomach, tape the button in place, and resume normal feedings. If your child has a PEG tube that comes out, replace it with a catheter, tape in place, and call the physician. It is sometimes normal to see drainage from the G-tube tract, especially during the first 6 weeks that it is placed. Drainage is usually yellow, brown, or cream colored. Leaking may occur through the tube itself or around the tube. There are many reasons that your child's tube may leak. Make sure that the tube is snug against the stomach. Check to make sure that the balloon is filled with the appropriate amount of water, then check again in a few hours to see if any water has leaked out. Illness may also cause your child's tube to leak, as well as the amount of formula and the speed that it is running. If you suspect this may be the problem, check with your child's doctor before changing the rate or amount of the feeding. Granulation tissue is dark red and bleeds easily. It may interfere with the position of the G-tube and cause leaking. Notify your doctor or the enterostomal department if you notice granulation tissue. Taping the tube or extension can help prevent this. Some children will always have a G-tube. As your child grows, he will need a longer tube. Have your child measured occasionally to see if he needs a longer tube. If your child's tube seems too snug, have your doctor or enterostomal therapy nurse check to see if he needs a longer tube. Some children will learn to eat enough that they will no longer need their G-tube. When you and your child's doctor decide the G-tube is no longer needed, it is easy to remove the tube. After the tube is out, the opening will usually close on its own within a couple of weeks. Until it closes fully, protect your child's skin with a barrier cream and keep a bandage over the opening to absorb any leaking. Be sure to use a barrier cream that you have not used on your child's diaper area. If the opening does not close on its own, it will have to be closed with surgery. This is usually done in outpatient surgery. We encourage you to participate in the care of your child's G-tube as soon as it is placed. Your child's enterostomal nurse and discharge planner will help you know how to get the supplies when you go home. The more you help with your child's care, the more comfortable you will be giving your child's feedings and caring for his G-tube. Soon, you will be the expert.